Welcome to Breast Cancer Breakthroughs. We just got back from the biggest breast cancer conference of the year, the San Antonio Breast Cancer Symposium, or SABCS for short. This conference is where all of the leading researchers and patient advocates gather together to share their findings on some of the biggest clinical trials and research studies that are changing the way that patients receive treatments in the clinic and evolving our understanding of breast cancer. More than 10,000 people from more than 100 countries gathered to discuss these exciting findings and what they might mean for patients. Today, we are going to talk through some of the big headlines that came out of SABCS and hear from some of our Komen scientists what these new developments might mean for patients. One very exciting finding was announced for patients with metastatic hormone receptor positive HER2 negative breast cancer with mutations to a gene called PIK3CA. These mutations can cause breast cancer to be very aggressive and difficult to treat. To find better targeted treatments for these patients, the phase 3 INAVO 120 trial tested a new drug called inavolisib, which targets PI3 kinase in combination with palbociclib and fulvestrant versus palbociclib and fulvestrant alone in the control arm. This trial was specifically tailored to patients with metastatic hormone receptor positive breast cancer that have a mutation in the PIK3CA gene. Researchers found that adding inavolisib to this treatment regimen led to an incredible 15-month progression-free survival compared to just 7.7 months with palbociclib and fulvestrant alone. This is a 7.3-month increase in progression-free survival, which is absolutely huge for patients. This is a big win, and we're really excitedly following these findings. In our last episode, we discussed the exciting announcement that there were positive findings from the TROPION-Breast01 phase 3 clinical trial studying datopotamab deruxtecan, or Dato-DXd. The TROPION-Breast01 trial was studying how well Dato-DXd worked for patients with metastatic estrogen receptor positive breast cancer who have been previously treated with 1 to 2 lines of therapy. The initial results of the study were announced at the 2023 ESMO conference, which was the European Society for Medical Oncology, back in October 2023. You can read about this in the Komen blog, which we've linked below. At SABCS, we saw updated safety results for the TROPION-Breast01 trial. Patients who received Dato-DXd were able to have an extra 6 months of improved physical function before decline compared to those who received chemotherapy. And patients receiving Dato-DXd had more than 3.5 months compared to chemotherapy before an increase in pain. Overall, this is a really big win for patients because these people had fewer side effects, they were able to stay on their therapy longer, and they were able to experience a better quality of life while they were on their treatments. We spoke to a new Komen grantee, Dr. Isaac Chan, who was really excited to hear these results.
I was really excited to see the Dato-DXd data. I thought that was super exciting. The survival curves look really good. I think it really showed clear advantage of Dato-DXd over chemotherapy. I think it's consistent in line with some of the earlier Dato-DXd data that we've seen. I'm really excited about that drug and the field of ADCs in general. I think there's a lot of questions that emerged from there that was really good. I think Dr. Littman asked a good question about biomarkers, the use of TROP2 as a potential biomarker for TROP2 targeting ADCs. And, I think that's one area where the field is working really, working towards. I think Dr. Bhatia said it correctly where, there's a lot of unknowns about even just using TROP2 as a biomarker. We don't know, the threshold of expression in terms of activity. We don't know the timing of expression, whether it fluctuates, and how well that fluctuation correlates with outcome data. And so I think this is an area that's, actively being explored. And I think that's kind of exciting because we have a lot of good drugs that are already very effective. And, if we compare them in patients where they would be the most effective, you could imagine the impact that this class of therapies can have.
Dato-DXd is not currently FDA approved, but we'll keep you updated when this approval is announced. Check out our 4th episode of Breast Cancer Breakthroughs to learn more about Dato-DXd. At SABCS this year, we also heard the first results from the phase 3 HER2-CLIMB-02 trial, which tested a new combination of HER2 targeting therapies, tucatinib and TDM1, in the second-line setting of metastatic HER2-positive breast cancer. One important thing to note about this trial is that about 43% of people in this trial had brain metastases. And this is really unique because most clinical trials will exclude people who have brain metastases from being included. Living with brain metastasis is a really difficult thing. It can decrease someone's quality of life, and it's really difficult to treat people with brain metastases because of the blood-brain barrier that prevents most treatments from accessing these brain metastases. But results from the HER2-CLIMB-02 study showed that patients had a median of 7.8 months before their cancer progressed, compared to 5.7 months alone for those who were only taking TDM1. This means that even patients who had brain metastases were able to receive some benefit from this treatment. In light of these results, we may have new options available for people who are living with metastatic HER2-positive breast cancer. If you want to learn more about HER2-positive breast cancer, check out our last episode of Breast Cancer Breakthroughs to learn more about the treatments that are available and what's left to come for research discoveries. Right now, immunotherapy is only an option for patients with triple-negative breast cancer. But some of the findings from this year's San Antonio Breast Cancer Symposium may change that. Two phase 3 clinical trials, the Checkmate 7FL and Keynote 756 clinical trials, are testing immunotherapy drugs in people with ER-positive breast cancer. These results were also preliminarily announced at the ESMO 2023 Breast Cancer Conference, which you can read about on the Komen blog, linked below. But updated results were presented at SABCS, and this shed some light onto which patients were really most likely to derive the most benefit from immunotherapy in the estrogen receptor positive setting. Researchers found that tumors which had high levels of the PD-L1 protein and low levels of estrogen receptor were the most likely to receive benefit from this treatment. We spoke with Komen researcher, Dr. Justin Balco, who is looking forward to what's in store for immunotherapy for estrogen receptor positive breast cancer. And he discussed how he hopes clinical trials will be designed to get these drugs to the right patients.
There was a number of different studies that were updated from ESMO this year on high-risk ER-positive patients and the impact of immunotherapy. So immunotherapy is something that my lab works on, trying to identify the right biomarkers for patients. We've developed some really clinically useful ones that we're going to, I think, get the opportunity to deploy in ongoing clinical trials in this setting. So I think that, I have always been very interested in the triple-negative breast cancer space because that was the most obvious place that there was the best chance of likelihood that, the best likelihood that immunotherapy would be effective in triple-negative. But as we know, as aggressive as disease it is that a big of an impact that can have on the breast cancer field as a whole. The majority of our patients are ER-positive. And so seeing it work, even if it's in a subset of patients, which we don't realize yet, is really, really encouraging. And so I think that there's a huge opportunity for impact. What I do hope, and that I see in the field that could be a problem, is right now immunotherapy is approved in all triple-negative breast cancer patients. But we see really only a benefit of 10 to 15%, maybe even in terms of event-free survival, which means we're massively over-treating triple-negative breast cancer patients with these drugs that can cause permanent and or life-threatening toxicities. And so once we've done that, it's really, really difficult to go back. So this reinforces that we need biomarkers going forward, and that can be a really tricky thing to do when those phase 3 trials that lead to approval are being guided, managed, and sort of guarded by industry. And so I think as a field, we need to be really careful, particularly given the fairly small benefit that we see in triple-negative breast cancer and now seeing in ER-positive breast cancer, but very clinically meaningful, of making sure that we're not just doing exploratory biomarker analysis for manuscripts and for scientific reporting, but we're really taking the biomarkers that have shown activity in other tumor types, in breast cancers, in the literature, and making clinical assays out of them and being proactive about the way that we test them and integrate them into our ongoing clinical trials, or else we could be in a problem area of immunotherapy gets approved for all high-risk ER-positive breast cancer patients, and we don't have a good way of selecting patients that are most likely to benefit because we can't do those de-escalation trials.
One exciting announcement that came out of SABCS this year was that there were several practice-changing results that may lead to de-escalation of radiation in some surgical procedures that would apply to a chunk of patients. The NSABP B51 trial found that patients whose lymph nodes became free from cancer cells after receiving neoadjuvant chemotherapy do not benefit from additional radiation after their surgery. Komen scholar Dr. Reshma Jagsi presented 5-year results from the IDEA trial and found that postmenopausal women who are aged 50 to 69 with low risk stage 1 ER-positive breast cancer can also safely forego radiation, and they can do this after their breast conserving surgery. Finally, there were 3 talks presented that concluded that axillary lymph node dissection or removal of the lymph nodes in the armpit is unnecessary in some cases for some patients. This is really exciting news for patients. Being able to de-escalate some of our surgical and radiation treatments for patients without compromising outcomes is one of the big goals of breast cancer research right now. By de-escalating some of these techniques, we're able to improve patients' quality of life and decrease the burden of their treatment, helping them live longer, happier, healthier lives during and after their breast cancer treatment. Axillary lymph node dissection in particular can be associated with a really debilitating syndrome called lymphedema. Lymphedema can cause really difficult and uncomfortable swelling in the arms and legs, and this can be a real burden for people to live with. For more information on these trials and to understand a little bit better how treatment de-escalation works, check out the links in our description. For the first time ever, SABCS featured a spotlight session on molecular and functional imaging, which is led by Komen scholar and leader in the field, Dr. David Mankoff. We asked Dr. Mankoff to explain what this is and why is imaging such an important topic.
I've got to start by saying, as a molecular imager, I'm so proud to have a spotlight section devoted to molecular and functional imaging. This is probably different from what many people are used to, where you think of imaging as something like a mammogram or a CT scan, and you're looking at structures and you're looking for abnormal shape and density. In functional molecular imaging, you're actually imaging in many ways the in vivo biology of the tumor. And you're looking at features such as its blood flow and perfusion, for example, by MRI. And you're also looking at its molecular features such as glucose consumption, the expression of targets such as ER, estrogen receptor, and HER2. And so it's a technique that is not so much about looking for structures, but looking for in vivo biology and biochemistry.
We asked Dr. Mankoff how molecular and functional imaging can benefit patients. He told us how molecular and functional imaging has the power to give answers about treatment response earlier than simply waiting for progression on a scan.
So I want to make a point about the ability to use molecular imaging to make an early assessment of response. Number one, if the treatment is not the right treatment and not working, and you can find that out in 3 weeks rather than 3 months, that's great. The other thing is, in many cases, people are nervous about having the disease progress, and knowing as early as 3 or 4 weeks that you're at least not resistant at that point, and can come back to that over the course of treatment, gives oncologists a new tool to allow them to continue effective treatments, even if it's not eradicating the cancer, but at least controlling its growth before having to switch. And with metastatic breast cancer, it's a long game. You want to use every treatment that's effective as long as you can. And these tools not only tell you which ones aren't effective early on, but can really give people confidence to know how long to use a treatment and perhaps when to switch.
Researchers and staff members at Komen also had their own opportunity to present their work at SABCS, including Komen's very own Dr. Jerome Jerquin. Dr. Jerquin is leading an exciting new research initiative based out of Susan G. Komen called ShareForCures, an innovative new breast cancer registry that is planning to compile data from thousands of patients across the United States in an effort to help researchers answer critical questions in breast cancer through the power of big data. We stopped by Dr. Jerquin's poster to learn more about ShareForCures.
So the work I'm presenting is about ShareForCures. This is the breast cancer research registry that we launched this summer at Komen. This is the first ever. We've never done that before. And it's really the idea of bringing people directly into research. So we're asking people on the street to basically join us in the effort and share their data so we can really boost the research boost the research that people are doing in breast cancer, like being able to answer questions that scientists need more data to be able to figure out why people are recurring first breast cancer, why people are still dying of breast cancer, all of those questions that we need more data for. I mean, the list is endless. So, like we are thinking a lot about metastatic breast cancer. All the, not just, how to cure the disease, I mean, obviously we want to do that, but also how to improve the quality of life of patients. This is, again, based on data that we're going to collect, not just, what the treatment outcomes have been, but also what is the experience throughout the journey, what is the experience now out of treatment of breast cancer survivors. Is there anything that we need to learn to make their life much better than it is currently?
Dr. Jerquin also explained the importance of being at SABCS and spreading the word about ShareForCures.
It is very important because if we walk in our little silos, if we don't tell anybody that we're doing it, we are not creating the movement that we need, which is really to connect the patients where they are, where they live, to the researcher, which is really why we're here. We want the researcher to know that this is coming online, that we are collecting the data that they need to bring ready questions to fruition and make sure that the next breakthrough is unparalleled by data. Not just, what is happening right now in clinical trials, which is we have a very few number of people who are being, who are able to get in clinical trials that the data are used for the next treatment. With this type of approach, is anybody anywhere in the US will be able to collaborate with researchers to bring their data, to bring what makes them different, what makes them respond to treatment or not respond to treatment. And that is critical as to why we're here.
To learn more about ShareForCures or to sign up yourself, check out the link in our description. Thank you all so much for watching. Here at Komen, we are committed to bringing you evidence-based information that can empower you on your journey with breast cancer. Don't forget to sign up for reminders for the Breast Cancer Breakthrough series. We've included a link to the homepage below. And finally, if you enjoyed today's episode, please take 2 minutes to fill out our survey to help us know what we're doing right and how to improve.